Coming up, we'll be on location at Metropolitan Spine in Ellicott City, Maryland, discussing the latest advances in pain management and how they can effectively help treat back pain, neck pain, and other types of pain with minimal discomfort and little to no downtime with one of this area's top doctors, Dr. Levi Pearson. Welcome, Dr. Pearson, to the Top Doctors Interviews program.
Thank you very much.
Pleasure to be with you today. We've got so much to talk about. There's been so many different advances in pain management, different treatment options that are very effective. And you're recognized as a top pain management doctor throughout the Maryland region. You've been recognized as a top doctor. You have a state-of-the-art practice here in Ellicott City, Maryland. You've helped so many patients get their lives back, Dr. Pearson.
Thank you.
I wanted to begin by asking you if you could please tell us about your vision for your practice.
We pride ourselves on being a small, very effective practice. We take a family-oriented philosophy in that when we have our patients come in, we treat them as family. We want to get the best outcomes possible. We want to treat them as individuals. So when each patient comes in, we take a very individualized approach in as far as their diagnosis and their treatment plan and hope for a great outcome.
That's wonderful. As I said, you've helped so many patients, and we're going to hear some patient stories a little bit later in this interview as well. Can you tell us about some of the most effective treatment options that you provide here?
There are many different evolving treatments in pain management. Some are fundamental and some are built upon those fundamentals to actually improve. Some of the things that we commonly do here are epidural steroid injections, cervical, transforaminal, translaminar, caudal epidurals. They can be done through different approaches for different situations, and we offer all of those. But not only that, also medial branch injections, radiofrequency ablations, genicular nerve blocks, and all the way up to more advanced types of pain procedures like high-frequency spinal cord stimulation, which we're very excited about at this time because we're able to treat more effectively low back and lower extremity pain as well as neck and upper extremity pain, but also recent FDA approval has been met for treating painful diabetic neuropathy.
So you offer many different treatment options for treating different types of pain, whether it's neck pain, back pain, spine, or any type of pain people are experiencing. Can you tell us a little bit about how these procedures are performed?
Procedures are performed usually here at our center. We went through great lengths to become not only accepted by Medicare, but certified by Medicare as an ambulatory surgery center. So most of the procedures that we need to perform can be performed right here at the office for convenience for the patient. So it's an on-site situation where we are actually performing these procedures much the same way that we would in a hospital setting. When the patient is actually brought in and registered, they are brought back to the procedure room, at which time appropriate monitors are placed, blood pressure, EKG, pulse oximeter. We then sterilely prep and drape the patient for their procedure, much as we would in the hospital. We have the equipment here necessary to actually sterilely perform their procedure, monitor them through the procedure, and have them go to the post-procedure area and be monitored for a short period of time there. We assess basically their pain scores when they come in, and we assess the pain scores as they leave. And the wonderful thing about the practice is that in most situations, patients leave with a much lower pain score when we're finished their procedure.
Oh, that's great to hear, and that's a huge benefit because a lot of these types of pain that people experience are debilitating. I mean, they really affect their life. They can't have activities with their family. They really, a lot of times, it's difficult for them to work. And then also, if they do more of the physical type of work, kind of stops their career
Absolutely.
and puts a hold on their entire life.
Yes, it does.
So you're pretty much bringing their lives back.
That's what we hope to accomplish.
And how long do these procedures typically take?
The procedures range in time from anywhere as short as once they're in the room and they're prepped and I start, 10 to 15 minutes. For a epidural injection or for medial branch injection, depending on how many levels may be involved, cervical procedures, sacroiliac joint injections, or genicular nerve blocks. all the way up to an hour or slightly longer if we're doing a spinal cord stimulator trial, which is normally performed before the actual implant is done once the patient receives satisfactory benefit. That can sometimes be much longer, maybe an hour and a half.
So that's not bad at all. I mean, actually, to come in here for a short period of time, and also it's a huge benefit that you perform these procedures here at your practice, so patients don't have to deal with that entire hospital process. As we know, most people don't like going to hospitals.
Many patients appreciate that.
Yeah, exactly, and myself included. If I can avoid a hospital, that's even better. And so what are some of the key patient benefits from these treatment options as compared to the traditional options?
Normally, with pain management, patients will normally contact probably their family practice physician or orthopedic physician, and they may start off with analgesics, oral analgesics, perhaps physical therapy, chiropractic treatment, things of that nature. In some situations, this may be adequate, and in some situations, it is not. We normally see patients when they are looking for some type of effective discontinuation of that pain process. And we will talk to them about what we primarily do here, even though we sometimes use medication when it's called for in certain situations, we primarily do interventional pain procedures. When we do these procedures, we have a goal in mind of attacking the generator after we made that diagnosis. We go in and we try to do a procedure which will address that generator, turn it off, and hopefully turn it off for a very long period of time. When a patient comes in, as I've mentioned before, we take a measure of their pain score. And after the procedure has been described to the patient, the risk and benefits, when the procedure is performed afterwards in recovery, we repeat that assessment of their pain score. And we are hoping that it is drastically reduced because of the fact that we are using local anesthetic as well as powerful anti-inflammatory medications for these procedures. So we hope to get them started on the road to pain relief right away.
So it's not a cookie cutter approach because you realize that every patient is different and they're
Absolutely.
experiencing different types of pain. So you actually take the time with each patient, and that's what patients love about your practice.
Oh, thank you.
They're not seeing 100 different providers and kind of herd it through an assembly line. You sit down with each patient to get to understand what they're dealing with, what they're going through, and how that may have occurred and how best to treat it.
Absolutely. Most patients appreciate the fact that I normally will be seeing them every time that they come. So they get to know me, I get to know them. It's a situation where we hope to get a great outcome. We hope to get a long duration of benefit. But when I do see a patient, if it might be a year, sometimes 2 years or more, the patient will be very appreciative of the fact that we took very good care of them initially, tried to do everything very comfortably so they feel comfortable returning to us. And it's a situation where even through a short series of procedures that might be necessary to get them comfortable, they know that I'll be assessing how they're doing as we move forward. And any adjustments that need to be made, I will be able to make those because I'm continuously working with them instead of them seeing someone different each time that they come.
Now, when do patients begin seeing relief or pain relief or start seeing the results from the procedure?
I like to tell patients that we look for immediate benefit. It's a situation where even though more than one procedure may be necessary, we strike out to try to give good benefit with the very first, continue that process through the full series if a series is needed. When we do these injections, as I mentioned, we use local anesthetic and powerful anti-inflammatory medications. So one of the benefits of the patient knowing that this is helpful is that hopefully they're leaving feeling much better. The medication is placed in a good location and basically they're confident that it's been performed well. The steroid effect usually will take place in a few days or 48, 72 hours. And the patient knows that that's going to be coming along after the local anesthetic to give them some relief, even after the first injection. But it's a snowball effect that we sometimes see where they're feeling better with the first one, better with the second, and much better with the third, and reach a certain plateau of comfort and hopefully ride that plateau of comfort for a very long period of time.
Well, that's wonderful, and I'm sure a lot of patients would love to hear that they can see those results that quickly.
Absolutely.
Is there any downtime after these treatments?
Usually there is no downtime. We try to be as cautious as possible through the procedures and do them as effectively and safely as possible. So there are usually no situations where there's any prolonged downtime. At the end of a procedure, we carefully assess each patient to make sure that they have no side effects. And if there are no side effects, it's a situation where some feel very comfortable with even returning to work after the procedure. So there is no downtime for most of our procedures as we carry those through. If they're going to have a larger, more advanced procedure, such as spinal cord stimulation, we inform the patient well ahead of time as far as what time responsibilities there might be for them having after procedure time to be with us for recovery, as well as any type of limitations they may have as far as reaching, bending, exercise, bathing, things of that nature after the procedure is done.
So you work very closely with each patient, kind of hold their hand through the process,
Yes. Mhm.
which is a great benefit for patients. And there's so many benefits from coming to someone like yourself. Not only do you have incredible credentials and you've helped and treated so many patients, and your experience and background are amazing, but it's also the fact that they don't have to go to a hospital, they don't have to deal with these huge practices where they just feel like they're one among many. They actually feel like old school medicine.
And that's what we try to project here.
And on that note, Dr. Pearson, I want to thank you so much for joining us today and being a guest on our program. This is extremely informative. You've helped so many patients. Please continue doing this great work.
Thank you.
And all the patients that are watching or potential patients can truly benefit from coming to someone like yourself.
I look forward to seeing them. Thank you so much for seeing me today.
The last 12 years I've had lumbar pain and I have degeneration in my spine. It was hard because I work in central material supply, so it was very important to keep it under control because of all the manual labor that I do. You know, it's labor intensive work. The epidurals really helped me. The results are great because they kept me working. I've been able to work and do housework and all kinds of things. I love Dr. Pearson because he is so into his patients and he cares so much about his patients. You know, we've called him in the middle of the night with emergencies, or, you know, we need, on the weekends we call if we need a injection on the last minute. He's available for us. He's patient oriented and keeping us out of pain.
The pain itself is all consuming. Every aspect of life is somehow affected by the pain. Working around the house, going to work, sitting, standing, sleeping, everything is affected by the pain. We had lumbar injections performed, and they helped. They helped a great deal. For example, now I'm going through a series of lumbar 2-3 nerve root injections or transforaminal injections bilaterally, because I'll have spasms in my thighs, and they're extremely painful, and they last about 15 minutes. And right now the injections are helping. They are helping a great deal. My experience I can summarize in one word: excellent. He really cares. I'd recommend anyone experiencing any pain in their spine, because Dr. Pearson will be there for you. He will take care of the pain, he will listen, and he will do whatever he deems is appropriate, be it an MRI, an X-ray, whatever study is necessary to give you a definitive diagnosis. And then he will treat that pain appropriately.
First was for my lower back, where I'd get to the point where I couldn't move. I'd be in like a C position in the bed, and I'd be there for 2 days or so. And then the other reason, it was pains in the neck and shoulders, vibrating down to the hand, creating numbness and tingling feelings. When the back would go out, I wouldn't be able to go to work and do a lot of things that I enjoy to do, such as camping, cooking, yard work. With the neck, well, that created issues with me working and doing my job because I'm a mechanic. So that altered a lot of things at times for me. I actually had gone to a neurosurgeon and they wanted to operate on me on my lower back, and I refused it because of the results that were going to be the outcome. I had spinal cord injections. It was a series of 3. By the time I had my second shot, I was feeling extremely better, and by the end of the 3rd, basically 99% of the pain in both areas dissolved themselves, and I haven't had an issue since. I wish I found him years ago. He is the most gentlest, kindest, heartwarming person I've ever dealt with. He explains things in a very simple term where everybody and anybody can understand it, regardless of your medical knowledge. He's very patient, and he's been very gentle when he's doing his procedures. Genuinely concerned about how you feel while he's doing it. He's, made a difference in my life by eliminating the pain and letting me get back to the things that I love to do and want to do. I would highly recommend him because of my experience, because, the pain he's relieved me of, the way he treats his patients, and the way he does his procedures. I've actually recommended him to 2 of my coworkers and to one of my friends.